Hi everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is premenstrual dysphoric disorder, also known as PMDD? Let's find out. Ooh, Okay, we're going to get into what premenstrual dysphoric disorder, also known as PMDD, is. Just before I get to that, though, I have to say that this is not the diagnostic criteria. This should not be used to diagnose anybody. Only a professional should be doing that. This is just a description of what's going on when we talk about premenstrual dysphoric disorder, also known as PMDD. And if that label bothers you in any way, if it doesn't help you to heal from what's going on, if it feels like it's hurting you in some way, then you don't have to use the label. Let go with the label, that's okay. So let's get into what premenstrual dysphoric disorder is, also known as PMDD. Now, one or more of these has to be going on, and they should be confirmed by what are known as daily ratings. But this can be diagnosed before being confirmed, but one or more of these things has to be going on. So marked affective lability, which just means that you have sudden shifts in mood, increased sensitivity to rejection or mood swings. Also increased interpersonal conflict or marked anger or irritability, marked feelings of hopelessness, self-deprecating thoughts, depressed mood, or marked feelings of being on edge, tension, and anxiety. So any of those four things. And then there also has to be one or more of the following. So less interest in usual activities such as friends, hobbies, school, and work. Subjective difficulty with concentrating. Marked lack of energy, easily fatigable or lethargy. Insomnia or hypersomnia. A feeling of being out of control or overwhelmed, and physical symptoms like joint or muscle pain, weight gain, a sense of bloating, or breast tenderness. So 5 of all of these things that I mentioned have to be present, and they have to be present for most menstrual cycles in the past year. And they have to happen in the final week before the onset of menses, and then improve within a few days after menses and be absent in the week post-menses. Menses, for those that don't know, is basically your period if you're a woman. So when blood and other matter are discharged from the uterus during menstruation. And the disorder has to cause significant distress in daily life, and it's not just an exacerbation of other disorders like major depressive disorder, persistent depressive disorder, panic disorder, or a personality disorder. However, it can be comorbid with any of those things. So any of those things could be going on at the same time as premenstrual dysphoric disorder. It's just that we can't call it premenstrual dysphoric disorder if it's just one of those things taken to a more extreme. So it's not something that's going on due to a substance or a medical condition, and if it's something where we haven't confirmed with those daily ratings that I talked about, then we call it provisional. Treatment, we have medication, contraceptives, psychotherapy, cognitive behavioral therapy. Just go in to see somebody and they'll be able to help you to find a treatment plan that works for you. And what does it feel like to have premenstrual dysphoric disorder, also known as PMDD. So for the person going through it in their body, they're going to feel things like joint and muscle pain, bloating, tenderness, weight gain, fatigue, insomnia, or hypersomnia. As far as what's going on in their head, they're just going to have trouble concentrating. It's going to be difficult going through doing their tasks. Emotionally, they're going to have mood swings, irritability, anger. They may get depressed and hopeless. They may feel on edge, overwhelmed, or out of control. Again, the mood swings is a lot of mood shifting. And then behaviorally, they may lash out. They may get into fights. They may isolate themselves. If you have this, you may have difficulty getting work done. You may have trouble enjoying activities that you normally do. So it's just a normal thing that happens for a woman. It's premenstrual dysphoric disorder, PMDD, and it's normal in the sense that it's not a normal thing that every woman experiences, but it's linked to the menstrual cycle, and it's just a psychological phenomenon. So nothing to be ashamed of. If it's going on, just go ahead and go in and see your doctor, see a therapist, whoever. Somebody will be able to help you with this. Just go ahead and see a professional who can hook you up with the treatment that you need. I hope I've given a good human perspective on what it is. If you have experiences that you'd like to share with it, please leave it in the comments below, and I appreciate you taking the time to learn about it with me today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay and you are loved. Thanks again for watching.